In this week's video, we will talk about the unpredictable, disabling disease of the central nervous system known as multiple sclerosis. We will discuss how it disrupts the flow of information within the brain and between the brain and body. Multiple sclerosis involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system, which is made up of the brain, spinal cord, and optic nerves. The exact antigen or target that the immune cells are sensitized to attack remains unknown, which is why MS is considered by many experts to be immune-mediated rather than autoimmune. Within the CNS, the immune system attacks myelin, the fatty substance that surrounds and insulates the nerve fibers, as well as the nerve fibers themselves. Myelin damage disrupts communication between your brain and the rest of your body. This can result in a wide variety of symptoms. Some people with severe MS can lose the ability to walk independently or at all, while others experience long periods of remission during which they develop no new symptoms. The disease is thought to be triggered by a genetically susceptible individual via a combination of one or more environmental factors.
There are 4 types of multiple sclerosis: relapsing remitting multiple sclerosis, secondary multiple sclerosis, primary progressive multiple sclerosis, and progressive relapsing multiple sclerosis. Relapsing remitting multiple sclerosis, otherwise known as RRMS, is the most common type of multiple sclerosis. People who have RRMS experience flare-ups, which cause symptoms to worsen. Then, patients experience a period of recovery, which can cause symptoms to lessen or even disappear. RRMS can then be triggered by an infection, which causes symptoms to worsen again. 85% of people diagnosed with RRMS will transition to secondary multiple sclerosis, otherwise known as SMS. People with SMS will continue experiencing the symptoms caused by the disease and may begin to recover until an infection triggers the symptoms to gradually worsen. The 3rd type of MS is primary progressive multiple sclerosis, otherwise known as PPMS, which occurs in about 15 to 20% of people diagnosed with MS. In PPMS, the symptoms gradually worsen. The 4th type of MS is progressive relapsing multiple sclerosis, otherwise known as PRMS. PRMS is rare and follows the pattern of worsening symptoms but with sudden flare-ups.
The symptoms of multiple sclerosis vary depending on the position of the nerve fibers that are being destroyed. These symptoms may include numbness or weakness in the limbs, typically occurring on one side of the body, partial or complete loss of vision, tremoring or lack of coordination, tingling or pain in parts of the body, dizziness or fatigue.
MS can occur at any age, but is most commonly found in individuals ages 15 to 60. Women are twice as likely to develop MS than men. If you have a parent or sibling with MS, you are more likely to develop the disease. White people, particularly those of Northern European descent, are at higher risk of developing MS. MS is more common in countries with temperate climates, including southern Canada, northern United States, New Zealand, southern Australia, and Europe. It is found that the closer you live to the equator, the less likely you are to develop the disease. However, scientists cannot prove why this is. Lastly, you have a higher risk of developing MS if you have type 1 diabetes, thyroid disease, or inflammatory bowel disease. Currently, the cause of multiple sclerosis is unknown. Scientists have many theories, but they have not yet been proven. Since the cause is unknown, treatments are difficult. There are different treatments for attacks and progression, which include oral liquids and pills, injections, and physical therapy. Scientists are working towards a cure for MS. Until we have the answers about the general disease and where it comes from, we can only continue research. As a community, we can raise awareness of MS to help speed the process of finding a cure.